Hello and welcome to Pisgah Health Today. My name is Angela Owen, and it's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Deb Tibbetts, who is the Executive Director of Smart Start Transylvania. Welcome to our program today, Deb.
Thank you. Thanks for having me.
We are thrilled to have you with us. Deb is an innovative leader who creates opportunities to make a difference through passion for early childhood and advocacy. Her strengths include organizational transformation, capacity building, fund development, collaboration, and financial management and compliance. She is experienced in for-profit and nonprofit enterprises in human service, early education, higher education, and information technology. During her 15 years as a resident of Western North Carolina, Deb has devoted her energy to the nonprofit sector. Her professional affiliations include working with the WNC Child Advocacy Network, a network of organizations who collaborate on policy advocacy to improve access to and quality of early childhood care and education programming in Western North Carolina counties. She is the statewide lead for the WNC Regional Smart Start Advisory Committee, comprised of the Western Region Smart Start organizations. She holds a bachelor's degree in economics from Wheaton College and a master's degree in business administration from Suffolk University. She has completed the Duke University Nonprofit Management Certificate Program, as well as the Transylvania County Vision Leadership Program. Her community service includes serving on the boards of the WNC Chapter of Association of Fundraising Professionals and the Brevard Transylvania Chamber of Commerce. And when she's relaxing, not sure when she does that with everything there on the program, on the resume, she enjoys the natural beauty of Western North Carolina, as well as traveling the world. And we are so excited that you are now a part of Western North Carolina and bringing all of those skills and talents to the table. Why don't you tell our audience about Smart Start Transylvania?
Thanks so much, Angela. Okay, so Smart Start is part of the statewide early childhood network in North Carolina called the North Carolina Partnership for Children. And that's a nationally recognized early childhood initiative that prepares children for success in life. So each county or grouping of counties has a Smart Start. Sometimes it doesn't go by Smart Start as a name. Sometimes it's called the XYZ Partnership for Children. So it's a little bit confusing in that way. The idea is that each county or grouping of counties that makes a region collaborates with other community-based nonprofits and service organizations and strives to understand the unique needs of its youngest citizens. And then the state funds that come through the Smart Start Network are invested in programming to meet those unique needs. And the local Smart Starts or Partnerships for Children are all separate nonprofits. So Smart Start is really a public-private partnership. The state funds that are attached to the Smart Start state funding source are one source of revenue. And Smart Start is mandated by state statute, and it was never intended to fully fund the needs of the youngest citizens of every community. It only funds a portion. So therefore, in order to fulfill our mission, we have to seek other sources of funding, like from private foundations, for example. So, and that is absolutely critical to fulfill our mission in a community. So for Smart Start of Transylvania County, our mission is simply that every young child is thriving. And all that we do supports this very simple yet powerful statement. And where we focus is on family support and child health, access to quality early learning, and early educator workforce development. And integral to our mission is partnership, leadership, and advocacy. We work by leveraging the strengths of our community partners to deliver programs. We run very few programs ourselves as a direct service. We are typically receiving funding and working on behalf of our collaborative partners. And speaking of collaborative partners, we have a very, very strong early childhood collaborative in this community called Get Set Transylvania. And people who are listening to this may have I hope, heard about Get Set. It's been in the press. It's been recognized nationally. So essentially, it's around 22 to 25 early childhood organizations, and it was formed about almost 6 years ago now. And the idea actually is very much in line with Smart Start's mission, and that is to collaborate through partnership and leverage the strengths of partners. And it was really formed to look at all that was going on in the community to help young children and to respond to a key data statistic that was troublesome, and that was our kindergarten readiness rate. And one of our former county commissioners, Paige Lamel, was a driving force behind getting this going. And so 6 years later, we are going strong. One of the greatest things that Get Set has achieved is to become a national partner of Sesame Street and Communities. And essentially, that is a trusted brand that now transcends 3 generations. It's 50 years old. And what it does is help us to reach families. It's all about leveraging the brand to reach families, as I said. So it's pretty simple words. I was going to expound on that, but it doesn't really need it. There's a key program that ties to Sesame Street, which I'm going to talk about in a little bit because it relates to Pisgah Health Foundation and some generous funding there. So we'll come back to Get Set. And I was also going to say that on the advocacy point, and Angela, you alluded to some of it in my bio, we are very active regionally and with early childhood partners and also statewide, and serve on various committees and advocacy groups. So the idea is that when I was explaining the local community collaboration, that also extends to regional and extends statewide. And at the end of the day, we want to advocate for the interests of young children and with the goal of influencing public policy. And the Western region of Smart Start executive directors are particularly active in reaching out and establishing rapport with our elected officials that serve in our state legislative bodies. So that's very important and key. So in terms of specific programming that we invest in concretely, so we assist to fund childcare subsidies, which our Department of Social Services administers. There is a Smart Start component to that funding, and then there's other funding that comes in from Health and Human Services for childcare subsidies so that families can get help with sending their kids to childcare. And we also administer the NC Pre-K High Quality 4-year-old program in our county. We support and invest in various early literacy programs. And this year during the pandemic, we received generous support from several sources, and we have been helping families with technology assistance during the pandemic. And that can be helping to provide technology, so tablets or laptops, and also helping with the service to stay connected, especially since school has been in a hybrid mode and interrupted. We've also been able to fund the Circle of Security program for caregivers that the Family Place operates. And we've also supported our early educators, again, with PPE and wage supplements. And that has obviously been in response to the pandemic. And then annually, we support our early educators with training, access to professional development and training. And then finally, this week, February 1st, we just implemented the Family Connects program. I'm going to pause there because I'm sure you're going to ask me about how Pisgah Health has supported us. And again, the Family Connects program is supported by Pisgah Health. So, and I'll catch my breath for a minute.
Oh, well, Deb, it's really incredible to just listen to all the many different ways and the many different components that come into, I think you mentioned partnership and leadership and advocacy. And I really hope our audience takes a moment just to soak in just the depth and breadth of what Smart Start is doing as you reach across those lines, you find those public-private partnerships, and you're doing those things on behalf of our youngest citizens. It's quite amazing. I'm not sure when you sleep, but nonetheless, that's where the partnerships come in play, as you
Exactly.
mentioned, I'm sure earlier. Well, why don't you bridge now and do tell us specifically how has Pisgah Health Foundation helped support something within that long repertoire of programs and opportunities that you're bringing to support our young citizens?
Sure. So Pisgah Health Foundation generously funded 2 grants to Smart Start, and I asked for those on behalf of the Get Set Early Childhood Collaborative. So another point of the partnership and leveraging community partners, I have done a lot of grant writing and fundraising on behalf of Get Set. And so one of those grants was to implement the Family Connects program. And Family Connects falls under our goal of children having access to a healthy start in life. And it is a program that is connected with Duke University, the Center for Child and Family Health. And we have worked with them for the last 11 months. There's a pretty lengthy foundation setting process and training process that you go through to come to a point where they will sanction that you can use their evidence-based program. So we've been working on that for the last 11 months. And essentially, it is a nurse home visiting program. And it connects parents of newborns to critical community resources within 2 weeks of having a baby.
Wow.
And it's amazing. And as well, as I said, a nurse home visitor helps to assess the health and medical needs of the family and the young child. And then the other component is connection to community resources. So when you think about that, the first 2,000 days of a child's life is absolutely critical for development. And it is so important. The earlier that you can start impacting a young child's life, the better. And it's so important to start early. What is so profound about Family Connects is it literally starts again at 2 weeks. So we are thrilled to be at this point. It is really going to be wonderful for this community. And, you know, when I talked about Sesame Street and communities, that helps us reach families that we haven't reached before. Certainly, Family Connects will help us, again, reach those families. And then I almost think of 3 legs of a stool. And then you think about all the partners in Get Set with all that they have to offer, which is immense as a group. And then you think about the opportunity for the nurse home visitor and our community alignment coordinator to connect families to all those services. And the way that I often talk about it and think about it is we're creating a circle of care around our community and our youngest citizens. And Family Connects is simply going to let us start so much earlier. So we already have our nurse home visitor participated in 2 appointments at Hendersonville Pediatrics this week with 2-week-old children. So there were 2 appointments already scheduled. And then we also have a sign-up form on our website, and we have a mom who's expecting at the end of the month. So we have a very aggressive communication plan going on, and everything is taking place through our Facebook page. And we hope during the month of February to just do tons of marketing on this and start recruiting families in need. So I mentioned Hendersonville Pediatrics. They are what's called the medical home for Family Connects, working in partnership with us. And we already partnership with Hendersonville Pediatrics for one of our early literacy programs, which is called Reach Out and Read. So we had an existing partnership in place already. And again, coming back to the partnership aspect of how we fulfill our mission, it's so important to continue to grow those and nurture those partnerships. So Hendersonville Pediatrics see a very large percentage of our families within a month of them having a newborn. So it was a natural fit to work alongside them. And then I wanted to also add, it's not the only way that we're going to reach out to families. We will gradually be expanding our circle, obviously, to the OBGYNs in the region. And then since we don't have a birthing center in Transylvania County, it's a little bit more complicated because we're going to have to work region-wide and reach out to all the different hospitals. And we will gradually, over the next few months, do that. So Jocelyn Turner Whitlock is our community alignment specialist, and her information can be found on our website. And then Janice Woodard is our nurse home visitor. And they're both super impressive women. Their bios say it all on our website. So I would encourage folks to go take a look at their background. So again, Pisgah Health Foundation funded this, was super supportive because we got delayed by 3 or 4 months due to the pandemic, and we certainly appreciate it. I'll pause before I move on to what the next grant was about. Sorry.
Well, I just want to touch base and make sure to repeat back for our audience. You mentioned the circle of care. And so I just want to make sure we're all connecting dots, because in this interview today so far, you've talked about medical care. You've talked about help with early childhood development center care. You've talked about technology components. You've talked about family components. Like, you really are hitting that 360 of all the things that we need for our little ones to be able to grow in a successful and healthy environment. And I'm not sure that we fully appreciate all of those pieces. And so I just wanted to make sure to highlight, it's not a one-dimensional thing that you have happening here at all, in any capacity. So within that and all of those sphere, where does that next grant take us in that circle?
So the second very generous grant that Pisgah Health Foundation awarded to Get Set was to support our Family Engagement Toolkit project. And about, a year and a half ago, we started, in conjunction with the partnership at Sesame Street, we started down a path of, Get Set did, of creating family engagement toolkits. And we outlined a very aggressive first-year schedule, which was 8 themed toolkits. They have some Sesame Street books in them, and a lot of the Sesame Street topics are around resilience, skill building, and trauma, and just general care, and teaching kids, basic coping skills really for life. I mean, and I'll be honest, a lot of the topics apply to adults as well when you spend time on their website. So what we had access to was all kinds of online content, as well as Sesame Street books. But we wanted to take it a few steps further, and the toolkits are actually a bag, and contained in it are toys and games. Really important, a community resource guide, which is also on the Get Set website. And again, similar to Family Connects, this is all about making people aware, families aware of the resources available in Transylvania County, and giving them the information to connect them to all those different community-based organizations and partners. So we embarked on, I think it was 8 topics in the first year. We initially didn't have any funding. So what we had to do, and we slowly started getting a small amount, and what we had to do was just create a low number of the initial toolkits. And then when we got the grant from Pisgah Health Foundation, we were able to go back and create more toolkits. And then now we're starting into, we did earlier this year, start into specialty topics. And of course, with the pandemic that came along, the opportunity for specialty topics were just even more magnified. So we've been able to continue on. We did complete, we have over 450 active subscribers through the Get Set Toolkit project and the Get Set newsletter, which was just recently launched. And we were able to complete end of the first year survey with the recipients and the feedback that we received was fantastic. I mean, hands down, families want to continue receiving these. They really felt that one mother said that they were cared about and connected, and they really wanted it to continue. So that's the other way that Pisgah Health Foundation has supported the early childhood community here.
That's a great testimony from that mother in a time when it would be so easy to be not feeling connected and not have that resilience to have these toolkits. And I had the privilege of seeing one of the early toolkits, and they're really remarkable.
Yeah,
That you've been able to put them together. Yeah, really, really special. Well,
yeah.
Deb, what else would be important for the viewers to know? How can they come alongside? How can they support you? Where can they find information about the great things that you're doing here in the community?
So of course, our website, smartstarttransylvania.org, and Facebook. And then there's links right from there to Get Set. Get Set also has its own website. Honestly, viewers can see a list of the partners in Get Set as well on the Get Set website. So supporting any of the partners is a wonderful thing. I would be remiss if I didn't put my fundraising hat on and say that supporting us and donating is always excellent, because that only helps advance the projects that we're working on in the early childhood community.
Fantastic. Deb, on behalf of the Board of Directors of Pisgah Health Foundation, I just want to say thank you to you, the rest of your staff, and all of those with whom you work so diligently to bring about this partnership and advocacy and leadership on behalf of our young citizens. Thank you so much to you and Smart Start for all that you're doing.
Thanks, Angela. And also on behalf of my board and staff, thank you to Pisgah Health, because those two grants have really advanced our mission. So we really, really appreciate the support.
It's really exciting and encouraging to hear. We also want to thank Wildflower Media for their technical and creative support in bringing these programs to you, and to say thank you to the Board of Directors and staff of Pisgah Health Foundation and the Physicians Roundtable. If you like this story and you'd like to support more like this one, let me encourage you to go to pisgahhealthinsider.org and join the movement. Until we see you on the next Pisgah Health Today, stay well and be well.